Altogether Active is a bold system-wide strategy for creating a more active, healthier and fairer Cheshire and Merseyside. It was commissioned by the Integrated Care System Population Health Board and developed by MSP and Active Cheshire in partnership with place-based and regional partners. As we put the strategy into practice, we'll be supporting the economy, reconnecting communities, and building back a stronger society following the pandemic. The gap between the highest and lowest life expectancy in our region is simply too great. The differences are felt acutely by our residents in areas of greater deprivation, where higher rates of cardiovascular disease, childhood obesity, and falls in later life are just a few of the factors contributing to both lower life quality and earlier death. Low levels of physical activity play a significant role in reducing life expectancy, and the pandemic has made the situation even worse. There's a strong correlation between those most affected and those least likely to participate in physical activity. In Cheshire and Merseyside, we have 500,000 inactive residents, and inactivity costs money as well as lives. The bill to the NHS across the UK is £1 billion every year. The scale of the problem means efforts by individual organisations just aren't enough. Altogether Active unlocks the full power of physical activity by joining up people and partners across the whole system. If you're watching this video, then you are part of the system. That means you're also part of the solution. By working in partnership with other organisations system-wide, you and your organisation can make a greater impact on reducing health inequalities. You'll be better able to support those who face the greatest challenges in becoming more active, and you'll see improved outcomes from the work you do. At place level, we're starting from a strong foundation, with plenty of assets and resources already in each area for Altogether Active to build on. Taking a life course approach will ensure that the benefits that physical activity can bring to health are embedded from cradle to grave. A whole system approach isn't just about creating interventions and programs. Instead, it's about considering all the settings we move through and making positive changes that will encourage healthier behaviours. Evidence shows that being active could help people improve their mental health too. Altogether Active will work with partners to embed physical activity within health pathways, making physical activity a more viable option for the health system. We need everyone who watches this video to be an advocate for Altogether Active. The Chief Medical Officer said that if physical activity was a pill, it could be described as a miracle drug. Add your name to our supporters list and receive updates by visiting www.champspublichealth.com/all-together-active.